Hello, I bring you the top 10 killer diseases globally. Number 1, Ischemic Heart Disease, IHD. What is ischemic heart disease? This, also known as coronary artery disease, CAD, is a condition in which the heart muscles does not receive enough blood and oxygen due to narrowing or blockage of the coronary arteries. These arteries supply oxygen-rich blood to the heart. When they are narrowed or blocked, the heart struggles to function properly, leading to chest pains, heart attacks, heart failure, and sudden death. The word ischemic means reduced blood supply, while heart disease refers to disorders affecting the heart. IHD develops slowly over many years and is often called a silent killer because many people may not experience symptoms until a severe event like a heart attack occurs. How does ischemic heart disease develop? The main underlying process causing IHD is atherosclerosis. This is a condition where fatty deposits or plaques made of cholesterol, calcium, and other substances build up inside the walls of the coronary arteries. Over time, these plaques narrow arteries, reduce blood flow, make arteries stiff and less elastic. If plaques rupture, a blood clot can form and completely block the artery, resulting in a myocardial infarction, or what we call heart attack. What are the causes and risk factors of ischemic heart disease, or as many people just know it as heart disease? IHD is caused by a combination of lifestyle, medical, and genetic plus environmental factors. The major causes are high cholesterol level, especially LDL, which we call bad cholesterol, high blood pressure or hypertension, which damages artery walls, smoking, which reduces oxygen in the blood and damages arteries, diabetes mellitus, which accelerates plaque formation, obesity, especially abdominal fat, physical inactivity, and unhealthy diet high in salt, sugar, and saturated fats. We also have non-modifiable risks. Examples: age. Risk increases after 45 years in men and 55 years in women. Sex. Men are at a higher risk, though women catch up after menopause. And then there is family history of the disease also. Emerging risk factors include chronic stress, excessive alcohol intake, air pollution, and poor sleep patterns. What are the symptoms of ischemic heart disease? Symptoms may vary from person to person. Some may have no symptoms until a heart attack occurs. Common symptoms, however, include chest pain, or what we call angina, that is tightness, pressure, and burning sensation. We can also have pain spreading to the left arm, neck, jaw or back. There is also shortness of breath, fatigue, nausea or vomiting, dizziness or fainting, cold sweats. In women, elderly persons and diabetics, symptoms may be atypical or mild, making diagnosis harder. Let us look at the global statistics of ischemic heart disease. This is the #1 cause of death worldwide. IDH causes 9 million deaths every year. It accounts for about 18% of all deaths globally. One person dies from heart attack every 40 seconds globally. More than 75% of IDH deaths occur in low and middle income countries. Cardiovascular diseases are rapidly rising in Africa due to urbanization. IDH was once rare in Africa, but is now a top cause of adult mortality. In Kenya, for instance, heart disease is among the top 10 causes of death. Increasing cases are seen among younger adults between 30 and 50 years due to lifestyle changes. These trends show that IDH is no longer a disease of the wealthy nations or the elderly alone. How do we diagnose ischemic heart disease? Doctors use several methods to diagnose IDH. One is ECG or electrocardiogram, which checks the heart electrical activity. We also have blood tests that detect heart damage markers like troponin, stress tests that monitor heart under exercise, and we also have echocardiography, that is ultrasound of the heart, coronary angiography, imaging of blocked arteries, CT coronary scans, and early diagnosis, if you present yourself, can save a life. When you get the symptoms, please hurry while stocks last. How can we prevent IHD or ischemic heart disease? The good news is that IHD is largely preventable. What you need to do is eat a balanced diet, reduce salt, sugar, and saturated fats, exercise at least 150 minutes every week. Split that by 7, that's around 20 minutes per day. Stop smoking completely. Limit alcohol intake. Maintain healthy weight. Manage stress. Get regular medical checkups. What else do you need to do? Try to control your blood pressure. And also check that you do not have diabetes, because when you get diabetes, chances of IDH shoots like nobody's business. Also, take cholesterol lowering medication when prescribed. And lastly, regular heart screening for high-risk individuals. How do we treat or manage ischemic heart disease? There is no complete cure for IDH, but it can be effectively managed, allowing patients to live long and productive lives. Through medication, aspirin prevents blood clots, statins lower cholesterols, beta blockers reduce workload, ACE inhibitors control blood pressure. Nitrates relieve chest pains. Medical procedures include angioplasty and stenting, that is opening of blocked arteries, coronary artery bypass grafting or CABG, which is surgical rerouting or rerouting of blood flow, pacemakers, and implantable defibrillators in advanced cases. Also, lifestyle modification can help, but medication alone is not enough. Long-term recovery depends on diet, physical activity, smoking cessation, cardiac rehabilitation programs. Can IHD be cured? While IHD has no cure, it can be controlled and reversed to some extent through early detection, strict lifestyle changes, proper medication adherence, surgical intervention when needed, and many patients live decades after diagnosis with good quality life. Lastly, ischemic heart disease remains the #1 killer globally, silently claiming millions of lives each year. It results from reduced blood flow to the heart due to blocked coronary arteries, largely driven by modern lifestyle habits. Despite its deadly nature, IDH is highly preventable and manageable. Public awareness, healthy living, early screening, and access to quality health care are the most powerful weapons against this disease. Addressing IHD is not just a medical responsibility, but a societal and personal duty. Disease #2, top killer disease, stroke, or as it is also called, Cerebrovascular Disease. What is stroke? A stroke, medically known as cerebrovascular disease, occurs when the blood supply to the part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Because brain cells depend entirely on a constant supply of oxygen-rich blood, even a few minutes without it can cause irreversible brain damage or death. A stroke is a medical emergency. The faster a person receives treatment, the greater the chances of survival and recovery. Stroke is one of the leading causes of death and long-term disability globally, affecting people of all ages, though it is more common in older adults. There are a number of types of stroke. There are majorly 3. One is ischemic stroke. This is the most common type, accounting for about 85% of strokes. It occurs when a blood vessel supplying the brain is blocked, usually by a blood clot. The blockage may form in the brain artery itself, which is called a thrombotic stroke, or travel from another part of the body, such as the heart, called embolic stroke. Then we have hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures, causing bleeding into or around the brain. The bleeding increases pressure on brain tissues and damages cells. Common causes include uncontrolled high blood pressure and weakened blood vessels. The third type of stroke is transient ischemic attack, or TIA, often called a mini stroke. A TIA is caused by a temporary blockage of blood flow to the brain. Symptoms usually last a few minutes to hours and then disappear. Although it does not cause a permanent damage, a TIA is a serious warning sign of a future major stroke. Okay, now what causes stroke? Stroke is caused by a combination of medical conditions, lifestyle factors, and genetic influences. What are the major causes? High blood pressure or hypertension leads to stroke. Then we have atherosclerosis, or the narrowing and hardening of arteries. We also have blood clots. We have ruptured blood vessels, heart diseases such as atrial fibrillation. What are the lifestyle risk factors? Smoking, excessive alcohol, physical inactivity, obesity, poor diet, and chronic stress. What are the medical or biological risk factors? Diabetes mellitus, high cholesterol, previous stroke or TIA, increasing age, family history of stroke, sickle cell disease, especially in children. Many of these factors are preventable or controllable, making stroke largely avoidable. What are the symptoms of stroke? Stroke symptoms usually appear suddenly. Common warning signs include face drooping on one side, arm weakness or inability to lift one arm, speech difficulty or slurred or confused speech, sudden loss of vision in one or both eyes, sudden severe headache with no known cause, dizziness, and loss of balance and coordination. The first rule helps identify stroke quickly. First, that is FAST. What is F for? Face drooping. When you see the face drooping, arm weaknesses, that is A. Speech difficulty, and time to seek emergency care. First, time to seek emergency care. Let me bring that up again. First, face drooping, arm weakness, speech difficulty, and time to seek emergency care. Let us look at the statistics involved with stroke so that we get the magnitude of stroke. Stroke causes 7 million deaths annually globally. It is the second leading cause of death in the world. Over 12 million new strokes occur every year. Stroke is the leading cause of long-term disability worldwide. Stroke rates in Africa are rising rapidly. It affects younger populations compared to developed countries. In Kenya, stroke is among the top causes of hospital admissions and deaths. Poor access to emergency care increases stroke fatality rates. Many survivors live with permanent disability due to delayed treatment. These statistics highlight the urgent need for prevention and early medical response. How do we diagnose stroke? Accurate and rapid diagnosis is critical. Common diagnostic methods include CT scan or MRI of the brain to determine stroke type, blood test to assess clotting and infections, electrocardiogram ECG to check heart rhythm, carotid ultrasound to detect blocked arteries, angiography to view blood vessels in the brain. How do we prevent stroke? 80% of stroke globally can be prevented. Just check on your lifestyle, control blood pressure, stop smoking, eat healthy, reduce salt intake, exercise regularly, maintain a healthy weight, limit alcohol, manage stress. Medical prevention include proper management of diabetes, treatment of heart conditions, use of blood thinning medication when prescribed, regular medical checkups and screenings, and creating public awareness also plays a crucial role in stroke prevention. How do we treat stroke? To treat ischemic stroke, clot dissolving drugs like thrombolytics are given. Mechanical thrombectomy to remove large clots. Antiplatelet and anticoagulants medication can also be given. How do we treat hemorrhagic stroke? Blood pressure control, surgery to repair ruptured blood vessel, removal of accumulated blood, and medications to reduce brain swelling. Rehabilitation. Recovery often requires long-term rehabilitation, including physiotherapy, speech therapy, occupational therapy, psychological support. Rehabilitation helps stroke survivors regain independence and improve quality of life. Can we cure stroke? Stroke cannot be fully cured, but its effects can be minimized or reversed to some extent if treatment is given promptly. Many patients recover partially or fully, especially with early interventions and consistent rehabilitation. However, severe stroke may result in permanent disability or death, making prevention the most effective strategy. Stroke is a devastating but largely preventable disease that remains a major cause of death and disability worldwide. It occurs when blood flows to the brain is disrupted, leading to rapid brain damage. High blood pressure, unhealthy lifestyles, and lack of awareness significantly increase stroke risks. Early recognition of symptoms, immediate medical care, and long-term lifestyle changes can save lives and reduce disability. Combating stroke requires individual responsibility, strong healthcare systems, and widespread public education. Number 3, which disease is a killer disease? Top 3, chronic obstructive pulmonary disease, COPD. What is COPD? This is a long-term progressive lung disease that makes it difficult to breathe. The condition is characterized by persistent airflow limitation that does not fully reverse, even with treatment. COPD mainly affects the airways and air sacs, or what we call alveoli, in the lungs, reducing the ability to take oxygen and expel carbon dioxide. COPD is an umbrella term that includes two main conditions. 1, chronic bronchitis, which is a long-term inflammation of airways with excessive mucus production. And 2, emphysema, destruction of the alveoli, reducing the lungs' surface area for gas exchange. COPD develops gradually and often goes unnoticed in its early stages, but the time symptoms become severe, significant and irreversible lung damage when lung damage has occurred. This makes COPD a silent but deadly disease and one of the leading causes of death worldwide. How COPD develops? In healthy lungs, air flows freely through flexible airways into elastic air sacs. In COPD, the airways become inflamed and narrowed. The air sacs lose elasticity or are destroyed. Excessive mucus blocks airflow. As a result, air becomes trapped in the lungs, making breathing increasingly difficult. Over time, the lungs lose their efficiency, leading to low oxygen levels in the blood and strain on the heart. What are the causes and risk factors of COPD? COPD is largely caused by long-term exposure to lung irritants. Major causes: cigarette smoking, the leading cause globally. Second-hand smoke also. Third, indoor air pollution, especially from cooking with firewood, charcoal, or kerosene in poorly ventilated homes. Outdoor air pollution is also a cause. Occupational exposure to dust, chemicals, and fumes also. What are the medical and biological factors? Genetic factors such as alpha-1 antitrypsin deficiency, though it's rare. Recurrent childhood respiratory infections, poor development during childhood, and aging. What about lifestyle risk factors? Smoking at an early age, poor nutrition, low physical activity, poverty, and limited access to health care. In low and middle income countries, indoor air pollution is a major contributor, and particularly among women and children. What are the symptoms of COPD? Symptoms usually worsen gradually and may include chronic cough, often with mucus, and 2, shortness of breath, especially during physical activity, 3, wheezing, 4, chest tightness, 5, fatigue, 6, frequent respiratory infections, 7, blue lips or fingernails, in severe cases that is. Next, swelling of legs due to heart strain, that is in advanced case of this disease. Many patients dismiss early symptoms as smoker's cough or normal aging, delaying diagnosis and treatment. Let us look at the statistics. COPD kills 3 million people every year in the world. It is the third leading cause of death globally. More than 390 million people live with COPD. 390 million people. That is Kenya times 6. You can imagine. Around, or the whole of the United States of America. Yes, the whole population. That's a lot of people. Around 90% of COPD deaths occur in low and middle income countries. COPD prevalence is rising in Africa. Indoor air pollution is a major risk factor. In Kenya, COPD is among the leading causes of respiratory-related deaths. Many cases remain undiagnosed due to limited screening. These figures show that COPD is no longer just a smoker's disease, but a growing threat to the public health. How do we diagnose COPD? COPD is diagnosed through a combination of clinical evaluation and tests. Common diagnostic methods include spirometry, that is the key test that measures lung function, chest X-ray or CT scan, blood oxygen level test, arterial blood sugar analysis, assessment of smoking and exposure history, and lastly, early diagnosis. How do we prevent COPD? We can prevent it through the following means: lifestyle and environmental check. Avoid smoking and exposure to tobacco smoke. Use clean cooking fuels and proper ventilation. Reduce exposure to dust and chemicals at work. Wear protective masks in polluted environment. Maintain good nutrition. What else do we have? Exercise regularly to strengthen lungs. Public health measures, tobacco control policies, public education on indoor air pollution, improved housing and ventilation, workplace safety regulation. Yes. Can we treat COPD? There is no cure for COPD, but treatment can relieve symptoms, slow progression, and improve quality of life. Medications include bronchodilators, which relax airways muscles to improve airflow. Inhaled corticosteroids reduce inflammation, and combination inhalers, antibiotic during infections, vaccination of influenza and pneumonia to prevent complications. We can also do oxygen therapy. It is used in advanced cases to maintain adequate oxygen levels and reduce heart strain. Pulmonary rehabilitation can also be done through supervised exercise, breathing techniques, nutritional counseling, patient education. Pulmonary rehabilitation significantly improves endurance and daily functioning. We also have surgical options, which is lung volume reduction surgery. Bulectomy also can be done, and lung transplantation, though it is rare. I've said COPD cannot be cured and lung damage is irreversible. However, with early diagnosis, smoking cessation, proper medication, lifestyle modification, disease progression can be slowed significantly and patients can live many productive years. Stopping smoking is the single most effective intervention. Complications in COPD. COPD can lead to serious complications including frequent lung infections, respiratory failure, heart diseases, or what we call cor pulmonale. Then we have lung cancer, depression and anxiety, reduced quality of life. All these complications. Lastly, chronic obstructive pulmonary disease is a major global killer that progresses silently and causes long-term suffering. It is driven mainly by smoking, air pollution, and occupational exposure. Despite being incurable, COPD is highly preventable and manageable. Reducing tobacco use, improving air quality, promoting early diagnosis, and ensuring access to treatment are essential in the combating of COPD. Addressing this disease requires both individual responsibility and strong public health policies. Let us look at disease number 4. Lower respiratory infections, LRI. What is LRI? Lower respiratory infections are infections that affect the airways and lungs below the throat, especially the trachea, bronchi, bronchioles, and alveoli. They are among the most common and deadliest infectious diseases worldwide, particularly affecting children under 5, the elderly, people with weakened immune systems. Common types of LRIs include, if LRI is new to you, these are examples of LRIs. 1. Pneumonia. 2. Bronchitis. 3. Bronchiolitis. 4. Pulmonary tuberculosis. It is classified separately from TB, pulmonary tuberculosis. And lastly, influenza affecting the lungs, what you call flu. If it affects the lungs, that is serious. So let me repeat: pneumonia, bronchitis, bronchiolitis, pulmonary tuberculosis, and influenza affecting the lungs. LRIs interfere with normal breathing by causing inflammation, fluid buildup, and impaired oxygen exchange. If not treated promptly, they can lead to respiratory failure, sepsis, and death. There are many types, so we'll look at a few of them. 1. Pneumonia. Pneumonia is the most severe and deadly LRI. It causes inflammation and fluid or pus in the alveoli, making breathing painful and difficult. Pneumonia can be caused by bacteria, virus, fungi, or parasite. Acute bronchitis is the inflammation of bronchial tubes, often following a viral infection. It causes coughing and mucus production, but is usually less severe than pneumonia. Bronchiolitis, it is common in infants and young children. It affects the small airways, bronchioles, and is often caused by respiratory syncytial virus, RSV. What causes LRI? Caused by bacteria like Streptococcus pneumoniae, Haemophilus influenzae, Staphylococcus aureus, Mycobacterium tuberculosis. We also have viral causes like influenza virus, respiratory syncytial virus RSV, coronavirus, adenovirus. Then we have fungal causes like Pneumocystis jivaeraceae, histoplasma. And this Pneumocystis jivaeraceae is common a lot in HIV and AIDS patients. Risk factors include malnutrition, weak immune systems, especially with those with HIV and AIDS, cancer, or diabetes, smoking and secondhand smoke, air pollution, crowded living conditions, poor sanitation, lack of vaccination, extreme ages for children and elderly. What are the symptoms? Symptoms vary, but they include cough, often with phlegm, or let me call it mucus, phlegm. Yeah, that one. Fever and chills, shortness of breath, rapid or difficult breathing. What else? Chest pains, fatigue, loss of appetite, bluish lips or fingernails, in severe cases that is. Confusion in elderly patients. In children, signs may include fast breathing, chest indrawing, and refusal to feed. Global statistics about this. LRI cause approximately 3 million deaths globally annually. They are the leading cause of infectious disease-related deaths worldwide. Pneumonia alone accounts for about 14% of all deaths in children under 5. 14%. Over 150 million cases of pneumonia occur each year. 150 million. 150 million is a lot of people. That is half of the people in Nigeria. And Nigeria is the most populous country in Africa, remember. Pneumonia is a leading cause of child mortality in Africa. In Kenya, LRIs are among the top causes of outpatient visits, hospital admissions, and deaths. Limited access to healthcare increases fatality rates. Seasonal outbreaks worsen the situation. These figures highlight the preventable nature of many LRI-related deaths. How do we diagnose this? Diagnostic methods: clinical examination, chest x-rays, blood tests, sputum analysis, pulse oximetry to measure oxygen levels, rapid antigen or PCR tests for viral infections. Rapid antigen can also help. I've talked about that, by the way. And hospitalization early can be very, very positive for you. How do we prevent LRIs? Vaccination. Pneumococcal vaccine can help you. Haemophilus influenza type B vaccine, influenza vaccine, COVID-19 vaccine, measles vaccine. These vaccines can help. Lifestyle measures: good nutrition and washing with soap. Avoid smoking. Reduce indoor air pollution. Use clean cooking fuels. Proper ventilation. Reduce overcrowding. Public health measures include health education, improved access to healthcare, early treatment of infections, strengthened immunization programs. Treatment and management of LRIs include medical treatment with antibiotics for bacterial infections, antivirals for influenza and other viral causes, antifungals for fungal infections, fever control medications, oxygen therapy in severe cases, intravenous fluids for dehydration. What about supportive care? Adequate rest, hydration, nutritional support, monitoring oxygen levels, and prompt treatment is also key. Complications of low LRI. If untreated or poorly managed, LRIs can cause respiratory failure, sepsis, lung abscess, pleural effusion, chronic lung disease, and sadly, death. Can LRI be cured? Most are curable, especially with diagnosis early and treated appropriately. Bacterial pneumonias respond well to antibiotics, while viral infections usually resolve with supportive care. However, severe infections, delayed treatment, or infections in immunocompromised individuals can be fatal. Prevention remains the most effective approach. In short, therefore, lower respiratory infections remain a leading cause of death worldwide despite being largely preventable and treatable. They disproportionately affect vulnerable populations, particularly children in developing countries. Poverty, malnutrition, lack of vaccination, and limited healthcare access contribute significantly to this burden. Reducing LRI-related deaths requires a combination of vaccination, early diagnosis, effective treatment, improved living conditions, and strong public health system. With proper intervention, millions of lives can be saved each year. 5. Disease number 5. Top 10. Cancer, also called malignant neoplasm, or should I say malignant neoplasm. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. In a healthy body, cells grow, divide, and die in a controlled manner. Cancer occurs when this process breaks down, causing cells to multiply uncontrollably and form a mass known as tumor. These cancerous cells can invade nearby tissues and spread to the distant parts of the body through the blood or lymphatic system, a process called metastasis. The term malignant neoplasm refers to cancerous growths that are aggressive and capable of spreading. Not all tumors are cancerous. Benign tumors do not spread and are usually less dangerous. Cancer can affect almost any organ or tissue, making it one of the most complex and deadly diseases known to medicine. Types of cancer. There are over 100 different types of cancer, commonly named after the organ or tissue where they originate. Major categories though are carcinomas. If you remember carcinogens, carcinomas. This is the cancer of epithelial cells, breast, lung, prostate, colon, carcinomas. Then we have sarcomas or sarcomas, cancer of the bones, muscles, and connective tissues. Third group is leukemias. Leukemias is the cancer of the blood and bone marrow. Then we have lymphomas or myelomas, cancer of the immune system. And lastly, we have this group called cancers of the brain and the spinal cord. Let me just repeat this. Carcinomas affecting breasts, lung, prostate, colon. Sarcomas, bones, muscles, and connective tissues. Leukemias, blood and bone marrow. Lymphomas and myelomas, cancer of the immune systems. Then we have the cancer of the brain and the spinal cord. Among the deadliest and most common cancers worldwide are lung, breast, colorectal, liver, prostate, stomach, cervical, and pancreatic cancers. How cancer develops? Cancer develops due to the mutation or changes in DNA that disrupt normal cell regulations. These mutations may activate genes that promote cell growth or oncogenes, inactivate genes that suppress tumors, prevent damaged cells from undergoing programmed cell death or apoptosis. Over time, mutated cells accumulate and form tumors. Cancer development is usually a slow, multi-step process, often taking years or decades. Causes and risk factors of cancer. 1. Lifestyle-related causes. Use of tobacco, excessive alcohol, unhealthy diet, physical inactivity, obesity. Environmental causes. Exposure to radiation, air pollution, industrial chemicals like asbestos and benzene, pesticides and toxins also. Infectious causes. Certain infections significantly increase cancer risks. For example, HPV, or what we call human papillomavirus, or what we also call cervical cancer. Actually, it leads a lot to cervical cancers. Then we have hepatitis B or C, liver cancer. Helicobacter pylori, stomach cancer. HIV increases risk of several cancers because of weakening your immune system. Biological factors or genetic factors, family history of cancer, inherited genetic mutations, aging, and hormonal factors. What are the symptoms of cancer? Unexplained weight loss, persistent fatigue, pain that does not go away, lumps or swelling, unusual bleeding or discharge, changes in bowel or bladder habits, persistent coughs and hoarseness, skin damages or changes. Or we can also talk about non-healing sores. Early stage cancer may cause no noticeable symptoms, which is why screening is crucial. What about global statistics about cancer? Cancer kills 10 million people every year. It accounts to about 1 in 6 deaths globally. So, on average, 6 deaths, 1 person is dying of cancer. Over 20 million new cancer cases are diagnosed each year. 20 million each year. Lung cancer is the leading cause of cancer-related deaths. Breast cancer is the most commonly diagnosed cancer worldwide. In Kenya, cancer is among the top causes of death. Common cancers in Kenya include cervical, breast, prostate, esophageal, colorectal cancers. Limited screening and treatment facilities worsen outcomes. These figures show that cancer is no longer a disease of wealthy countries alone. How do we diagnose cancer? Early diagnosis can help. Common diagnostic methods include medical history and physical examination, imaging tests like X-ray, CT scans, MRI, and ultrasound, laboratory tests, biopsy, gold standard for cancer diagnosis, biopsy. Then we have genetic and molecular testing. Cancer staging determines how far the disease can spread and guide treatment decisions. Can we prevent cancer? Up to 50% of cancers are preventable if you check your lifestyle, avoid tobacco, limit alcohol, eat balanced diet, maintain good weight, exercise regularly, protect skin from excessive sun exposure, medical and public health prevention, vaccination against HPV and hepatitis B, regular cancer screening, early treatment of precancerous conditions, reducing exposure to environmental carcinogens, public awareness and early screening can save your life. How do we treat or manage cancer? Cancer treatment depends on type, stage, and patient health. Main treatment options: surgery, removal of the tumor, chemotherapy, drug that kills cancer cells, radiotherapy, uses high energy radiation, immunotherapy, boosts the immune system, targeted therapy, attacks specific cancer cell features, hormone therapy, used for hormone sensitive cancers. What about palliative care or supportive care? Pain management, nutritional support, psychological counseling, end of life care when cure is not possible. Some cancers are completely curable, especially when detected early. Others can be controlled for many years, turning cancer into a chronic condition. However, advanced cancers may not be curable, though treatment can extend life and improve quality of life. Survival rates have improved significantly due to advances in medical science, early detection, and better therapies. In conclusion, let's say that cancer remains one of the deadliest diseases worldwide, causing millions of deaths each year. It is a complex group of diseases influenced by lifestyle, environmental, genetic, infectious factors. Despite its severity, many cancers are preventable, detectable, treatable, especially when diagnosed early. Combating cancer requires a comprehensive approach that includes prevention, early screening, access to quality treatment, and public education. With continued investment in healthcare and research, the global burden of cancer can be significantly reduced. 6. Alzheimer's disease and dementia. Dementia is not a single disease but a general term for a group of conditions characterized by a progressive decline in memory, thinking, behavior, and the ability to perform everyday activities. It occurs when brain cells are damaged or die, disrupting communication between neurons. Alzheimer's disease is the most common form of dementia, accounting for about 70% of all dementia cases. Other types of dementia include vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. Dementia mainly affects the older adults, but it is not a normal part of aging. While memory lapses may occur with age, dementia involves significant cognitive impairment that interferes with daily life and independence. How does Alzheimer's disease develop? Alzheimer's disease develops gradually and worsens over time. The brain undergoes abnormal changes long before symptoms appear. Key pathological features include amyloid plaques, abnormal protein deposits that accumulate between brain cells, neurofibrillary tangles, twisted fibers of tau proteins inside neurons, that is, loss of neurons and synapses, especially in areas responsible for memory and reasoning. These changes disrupt communication between brain cells, leading to brain shrinkage and cognitive decline. Types of dementia. Alzheimer's disease, which is characterized by memory loss, confusion, and difficulty learning new information. Vascular dementia, caused by reduced blood flow to the brain, often following stroke or small vessel disease. Lewy body dementia, associated with abnormal protein deposits called Lewy bodies, causing hallucinations and movement problems. Frontotemporal dementia, which affects the frontal and temporal lobes, leading to personality and behavior changes. And lastly, we have mixed dementia, a combination of any of those dementias we have just talked about. Causes and risk factors of dementia. Dementia results from a combination of biological, genetic, lifestyle, and environmental factors. Non-modifiable risks include age, mostly after 65 years, family history, genetic mutations. What about modifiable risks? High blood pressure, diabetes, smoking, obesity, physical inactivity. We also have poor diet, excessive alcohol, social isolation, depression, low educational attainment. Low educational attainment. Go to school, man. Managing these risk factors can significantly reduce dementia risks. What are the symptoms of Alzheimer and dementia? Symptoms worsen over time and typically progress through stages. Early stages involve mild memory loss, difficulty finding words, misplacing items, mild confusion. Middle stage include increased memory loss, difficulty recognizing people, confusion about time and place, personality and behavior changes, difficulty performing daily tasks. And late stage includes severe memory loss, loss of communication abilities, inability to walk or swallow, and complete dependence on caregivers. Let us look at the statistics now. 55 million people live with dementia worldwide. That's like the whole of Kenya. 10 million new cases occur every year. 1.5 million people die every year due to dementia and Alzheimer. Alzheimer's disease is the 7th leading cause of death globally. Women are disproportionately affected. Dementia, that means women suffer more on Alzheimer and dementia. Dementia cases in Africa are rising due to aging population. In Kenya, dementia is increasingly recognized among elderly. Okay. How do we diagnose dementia and Alzheimer? Common diagnostic tools include medical history and cognitive assessments, memory and thinking tests, brain imaging, that is CT or MRI, blood tests to rule out other causes, neurological examinations, early diagnosis, allowing for better planning and management. And how do we prevent dementia and Alzheimer? You can prevent it by controlling diabetes, maintaining normal blood pressure, exercising regularly, eating a brain healthy diet, smoking is a no, limiting alcohol intake, staying mentally active, maintaining social connections so that you remember most people, treating hearing loss, yes, and many more. How then do you manage Alzheimer? Medically, you can use cholinesterase inhibitors like donepezil, or you can do NMDA receptor antagonists like memantine. Non-drug intervention include cognitive stimulation therapies. Yeah, so such people need to do a lot of talking to people, dancing. Yeah, exactly. Structured routines, physical activities, caregiver education and support. And then we have palliative care, where we have safety planning, nutritional support, emotional and psychological support, end of life care. What are the impacts on life and society? Dementia places a heavy burden on families and caregivers, healthcare systems, and national economics. Caregivers often experience emotional stress, financial strain, and burnout. Support services are essential to reduce this burden, therefore. Can we cure Alzheimer's? Currently, it cannot be cured, but brain damage is is irreversible. However, early intervention, lifestyle changes, and treatment can slow progression and improve functioning for a period of time. Ongoing research offers hope for future breakthroughs. In conclusion, Alzheimer's disease and other dementia are progressive, disabling, and life-altering conditions that affect millions worldwide. While age is the strongest risk factor, many lifestyle-related risks are preventable. Early diagnosis, preventive strategies, and comprehensive care can significantly improve quality of life for patients and caregivers. Addressing dementia requires public awareness, strong healthcare systems, and caregiver support, plus continued research to reduce its growing global burden. Next up is diabetes, and mostly diabetes mellitus. What is DM? Diabetes mellitus is a chronic metabolic disorder characterized by a high level of blood glucose, which we call hypoglycemia due to problems with insulin production, insulin action, or both. Insulin is a hormone produced by the pancreas that helps glucose from food enter cells for energy. When insulin is absent, insufficient, or ineffective, glucose accumulates in the bloodstream, causing damage to various organs over time. Diabetes is a major public health problem worldwide. It is a leading cause of heart disease, kidney failure, blindness, and lower limb amputations, making it a serious killer and disability-causing disease. What are the types of diabetes mellitus? Diabetes mellitus is mainly classified into three types. Type 1 diabetes, that is autoimmune disease, where the body attacks insulin-producing cells in the pancreas. Usually, it develops in children, adolescents, and young adults. People with type 1 diabetes require lifelong insulin therapy. What are the causes? What does type 1 diabetes cause actually? It causes high blood sugar, excessive thirst, frequent urination, weight loss, and fatigue. Type 2 diabetes, on the other hand, is the most common form, accounting for 95% of all cases globally. Characteristics it is characterized by insulin resistance, where the body's cells do not respond properly to insulin, often combined with reduced insulin production. Often associated with obesity, physical inactivity, and aging. Symptoms of these include excessive thirst, frequent urination, slow healing wounds, blurred vision, and fatigue. It can sometimes be managed with lifestyle changes or oral medications, but some patients eventually require insulin. Gestational diabetes. This occurs during pregnancy when the body cannot produce enough insulin to meet increased demands. Usually, it resolves after delivery, but increases the mother's and child's risks of developing type 2 diabetes later in life. Then we have other types of this kind of diabetes, that is example, monogenic diabetes through genetic mutations, and secondary diabetes caused by medication, pancreatic diseases, or hormonal disorders. What are the risk factors of diabetes? For type 1, autoimmune destruction of pancreatic beta cells, genetic susceptibility, possible environmental triggers such as viruses. And for type 2, we have obesity, especially abdominal fat, physical inactivity, unhealthy diet, that is high sugar, high fat, low fiber. We also have aging, family history of diabetes, high blood pressure, and abnormal cholesterol levels. What about gestational diabetes? Hormonal changes during pregnancy. You see, gestational, this one only affects ladies or women. Obesity or overweight before pregnancy, and advanced maternal age. Family history of diabetes can also come in. What are the symptoms of diabetes? Quite a number of symptoms here. When excessive thirst, we call it polydipsia. Then there is frequent urination, also called polyuria. unexplained weight loss. We also have fatigue or weakness, blurred vision, slow healing cuts or wounds, recurrent infections, numbness or tingling in hands and feet, which is called neuropathy. And we also have skin problems such as dark patches in body folds. Dark patches in body folds. Type 2 diabetes can develop gradually, so symptoms may be mild and easily overlooked. Statistics. Over 537 million adults live with diabetes. That is data of the year 2023. Prevalence is rising due to urbanization, obesity, and aging populations. Let me just get back here. 537 million is, get this, a 16th of everybody on the planet Earth. 1 out of 16 people in the world has diabetes. If you see 16 people seated somewhere, there could be one ailing from diabetes. Terrible. Diabetes causes 6.7 million deaths every year. Type 2 diabetes accounts for the majority of these deaths. Okay. In Kenya, diabetes affects about 5% of all adults, with many cases undiagnosed. Urban populations show higher rates than rural populations. I think it's all about food and pollution issues. What do you think? Diabetes contributes significantly to cardiovascular disease, kidney disease, and mortality. Lack of awareness, limited healthcare access, and late diagnosis worsens outcomes. These statistics highlight the urgent need for prevention, early diagnosis, and proper management. Diabetes is diagnosed using blood tests that measure blood sugar levels. Common diagnostic tests include fasting blood glucose, FBG, measures blood sugar after at least 8 hours of fasting. Diabetes is diagnosed if FBG is greater than or equal to 7 moles per liter or 126 milligrams per deciliter. Random blood glucose is another way of diagnosing diabetes. Diabetes diagnosed if blood sugar is greater or equal to 11 moles per liter or 200 milligrams per deciliter. Oral glucose tolerance test is another way, and that is also called OGTT. It measures blood sugar before and after drinking a glucose solution. Diabetes is diagnosed if 2-hour glucose is greater or equal to 11 moles per liter, or like I said, 200 milligrams per deciliter. Okay, then we also have another test that is called HbA1c test. It measures average blood sugar over the past 2 to 3 months. Diabetes is diagnosed if HbA1c is greater than or equal to 6.5%. Early diagnosis allows for timely intervention and reduces the risk of complications. And what are the complications? 1. cardiovascular complications. 2, we have heart disease, stroke, high blood pressure, kidney damage, or what we call diabetic nephropathy. Okay, we also, kidney damage may progress to kidney failure, and dialysis or transplant may be required as a result. It can also result to eye damage, or what we call diabetic retinopathy.